Okay, so for your day-to-day documentation for patients coming in for treatments, you're going to go to Document, and you're going to go to the Note and the Experience log. So either one you want to click on to go in first is totally up to you. But let's say we're going to do Note first. So I'll click Note once the patient is checked in, then I can then go to Start. It will show me the basic patient information here, date of birth, all that stuff, and then any information that you put in under this patient's account during the evaluation. So if the chart name was changed to, what's their diagnoses? Left hip pain and left knee pain, you can write that up there. It will show their next doctor's visit, any plan of care expiration, max number of visits, and then any details about the chart will be in there as well. So if that's entered, that will all show up, and it kind of gives you a good snapshot of that patient. Okay, and then you're going to click Create Note. And so this will be here also, again, so you can kind of see. You'll also be able to pull up the last plans of care or evaluations that were done for that patient. So I can unclick this, and if there's an evaluation, which typically there will be, obviously, that will show up there. So then you have your text boxes that you can put in there. So you can put your total number of minutes, which is required, your pain level, if that's something you do in your office, your subjective, your comparable signs 1 and 2, your pre-treatment, your post-treatment, impairment, any success limiting factors, measurable progress, that visit, a safety concern, and then there's some flex fields. Now there's also the option to customize these, so you don't have to have all of these options in your clinic. That's a feature that you can change around. Note history, if you click on that, if they had any previous appointments, that will show up here. So then you have the option to basically copy and duplicate over what was done the last treatment. And so I can copy over all of the fields that were filled out and then just change them as I need to. So that's up to you and how you want to run it in your practice on the clinical side. Or you can just freehand and put in whatever you're doing for that particular visit. Okay. So once you've entered some information, what you're going to want to do is hit save before you toggle to the exercise log. Okay, otherwise you might lose it. So then you're going to click on the little bike there. Okay, I'm going to create the exercises for that patient for that day. Now, again, if they had previous exercise log, it will be here on the left-hand side, and you'll be able to copy and paste either all of the exercises from the last visit or one at a time. So that's up to you and what makes it easier for you. Okay, but if there's nothing there to copy and paste, what I'm going to go in and do is I'll pick from my exercise that I preset in there, okay? And then you can basically free text in here. So if I want to put like blue, TheraBand, and then let's say 20 times each way. So you can put as much text as you need to make it clear what was done. So if anyone else picks up that chart, it's very easy for them to duplicate it. You can also go in and say, okay, you know what, I want to actually start doing this visit, the ankle ABCs on the next visit. So I'll just click next visit, hit create, and then when it populates for the next visit that you see them, when it's populating here on the right-hand side, this ankle ABC will be grayed out. So it's clear to you or whatever clinician sees that patient that that's something that needs to be initiated that next visit. Okay. If I want to create an exercise, let's say that's not in this bank here, then I would go to New Experience. I could create my exercise here. So let's just say it's gait backwards or something like that. Okay. If I make it private, it will only stay to myself and my team that's underneath me. If I make it public, it will be available for the entire practice to use. So that's up to your supervisor, however you want to do that. The obsolete button is basically if there's something in there that you no longer want, you just turn that into yes, it's obsolete. Okay, so I'm going to create that exercise. And then I'm going to do, let's just say we did 2 laps in parallel bars. So create. Okay, and then any of these you can open back up and change however you need to do. Okay, and then I can go back to the note. Okay, and let's say I'm going to, finish up my note here. Put whatever I need to put in here. Anything that's not entered won't show up. Okay, so put all that in there. Okay, and then if you're a therapist, you have the privilege there to actually approve the note. If you are a clinical assistant or physical therapy assistant and you need the therapist to sign off on it, then you only have the option here to do save and close. Okay, so then the therapist will then have access to be able to open all of those and approve them. If for some reason the patient comes in and they say, I'm going to my doctor, and they're leaving that visit already, and you don't have time to do a full plan of care with them, you can do approve and fax so that you can at least send the most recent note to the doctor. Okay, so I'll kind of show you how that works. So let's see, I'm going to do approve and fax. Wonderful, didn't work. Okay, so we'll do approve right now. Okay, so the error that it's throwing me is it says it needs one visit. So one thing I can't do is approve this note until my treatment codes are entered for that day. Okay, because that will populate here, because for some of the insurance companies, they'll need to know that on the note as well. Okay, so in that case, as a therapist, I would just do save and close, and then I would go check the patient out, and then I would come back to that and approve it.